Hi, everyone. Let me pull up my slides. Sorry to disappoint. I am not Britney Spears. I do not have her musical or movement talent, but it's great to be with you guys today. My name's Brittany Simpson, and I am a physician and geneticist. And I've had the pleasure of working with the Kabuki Syndrome Foundation for several years now. And I'm excited to share a new collaboration. Can you see my slides?
Yes, we can see them.
Thank you. And so today, as Bruce has already alluded to, we are so excited to let the community know that uh, we have these wonderful sites already through Toronto and Boston and Baltimore, as well as Seattle. But we would like to also announce that St. Jude is going to become a consortium site as well through KSOC at the KSOC. We are located geographically there. And so really you say St. Jude, well, they are really just cancer. Our children do not have cancers, right? Well, that is correct. And so I want to bring us back to actually the St. Jude mission. So the mission of St. Jude is to advance cures and means of prevention for pediatric catastrophic diseases through research and treatment. And so through that mission, they have now expanded to neurologic conditions. So the Pediatric Translational Neuroscience Initiative brings that mission of St. Jude to children living with catastrophic pediatric neurologic disorders to change the treatment landscape and improve quality of life. And thus, we would like to leverage that mission and goal and align it with the Kabuki Syndrome Foundations and KSOCs as well. And so, as you can see, previously the consortium, while it did have a large reach, we will now be able to cover a wider geographic area without that same, with less travel for a lot of the country as well for individuals and families that are interested in participating. And not only that, we will be able to bring the expertise through this new PTNI, that Pediatric Translational Neuroscience Initiative that I alluded to, as St. Jude has inherent expertise in some of the areas as well as some new expertise. And so I want to go back to that survey that Jessica just presented before the break. And again, please complete the survey. As you can see, we're using the old one for great questions and endeavors, but the new survey will also help. And so you answered. So the top two, which actually were tied for impact areas, would be learning and intellectual disability, but also low muscle tone and coordination issues. And so really that aspect is not being addressed yet through the consortium. And so actually with the PTNI through the Center for Experimental Neurotherapeutics, we will be developing a neuromuscular outcome measure, leveraging the expertise of our center. So the center is actually run by Dr. Richard Finkel, who is a lovely neurologist with expertise in not only neuromuscular conditions, but actually in biomarkers and clinical trial outcome measures. And so he has really helped drive forward therapeutics within the muscular dystrophy space, spinal muscular atrophy, and also has developed condition-specific outcome measures with conditions such as Charcot-Marie-Tooth. So we're going to leverage that expertise to bring that to our Kabuki syndrome community through KSOC. But not only that, we know that there are other areas that St. Jude is at a unique position to help for future. And so while we're not looking now, we're still looking forward to the future. So like I said, the low muscle tone we're going to initially address, but also you can see not too far down were immune system issues. And so St. Jude also through cancer research has expertise within the immune system. And so that is also something we hope in future to bring to the consortium. And that also is a very I think a more ideal area to impact for individuals, not only is it impactful, but given the immune system's inherent changes that occur over the lifespan and also how quickly they can change, I believe it is an area that medications will impact. And so we need to be able to know if we are impacting it for the good or bad, but also it could be an area that is more easily change so that the therapeutics can make the KMT2D and KDM6A machines more efficient for immune system functioning. And so, with that, I just want to thank everybody and look forward to any questions through the Q&A.